Hello, everyone. This is my program evaluation project, Healing Through Creativity, the Role of Art Therapy in Building Self-Esteem in Youth in Foster Care, presented by Misty Webb. A summary of the project topic, I'm going over self-esteem, vulnerable population at risk, youth in foster care, art therapy benefits, and the overall interest in the topic. The development and cultivation of self-esteem are significantly shaped by the self-perceptions we construct. These positive or negative perceptions play an important role in our psychological well-being. Previous research has found that youth in foster care often face a history plagued with significant trauma, including neglect, mental and physical abuse, and exposure to violence. These experiences can profoundly influence their self-perceptions and are strongly correlated with conditions such as depression, anxiety, PTSD, and low self-esteem. As a result, this demographic faces a heightened risk of engaging in negative behaviors and struggling with self-worth. In response to these challenges, art therapy programs emerge as an important intervention that provide essential support to promoting self-expression and internal reflection, thereby enhancing resilience and self-esteem with youth in foster care. My interest in understanding the impact of art therapy and its benefits is that I've been conducting group art education programs during my past internship. I found a significant improvement within the female adult individuals I worked with. Within my professional career, I work with youth in foster care, providing them with activities and opportunities they typically would not have the opportunity to participate in. A majority of the youth in our program have suffered some of the worst trauma, which has had a significant impact on their ability to interact and engage in the world around them. My interest lies in learning how art therapy could be a benefit to these youth as an alternative approach to healing. Okay, so the research question and a bit of details of what is involved. The proposed study aims to evaluate the use of art within psychoeducation groups, focusing on youth at risk within the foster care system and determining whether creating art group therapy settings improves self-esteem for this particular population. The possible outcome of using art therapy intervention is that at-risk youth will improve their self-perception and increase their self-esteem. Clients may not be ready to discuss their traumas, can still find personal expression and healing through nonverbal means. Various art therapy interventions will provide opportunities and healing through nonverbal means. Various art therapy interventions will provide opportunities for discovering new forms of healing and self-awareness, ultimately enhancing self-esteem. The anticipated outcome of using art therapy interventions is that at-risk youth will enhance their self-perception and increase their self-esteem. Clients who may not be ready to discuss their traumas can still achieve personal expression and healing through nonverbal means. Various art therapy interventions will offer opportunities to discover new forms of healing and self-awareness, ultimately enhancing their self-esteem. Methodology. The group of art therapy program will be offered at a centralized county resource centers. Each participant will be asked to fill out a survey from the beginning and end of each session. The survey used to measure self-esteem will be the Rosenberg Self-Esteem Scale. These surveys will collect data to evaluate participants' overall experience and perception of participating in a group art therapy as the intervention. The study will use a two-group experimental design, including a pretest and a post-test and control comparison groups. Participants in each group will engage in 8-week session meeting once a week. The outcome evaluation aims to evaluate the impact of art therapy on enhancing youth self-esteem. The sample will consist of a target population of youth in foster care system aged between 14 and 20 years of age. The estimated number of participants required for the study will range between 10 to 30 individuals. All demographics will be considered to ensure a diverse sample. A random sampling method will be employed to select participants, allowing for representative and varied groups. Given that the population is vulnerable and is at risk, extensive measures will be implemented to ensure participation protection. Results, conclusion, implications, and further research. Art therapy intervention program provides an opportunity to evaluate the effectiveness and impact of art therapy and compare outcomes between expressive art therapy and traditional talk therapy. Many individuals, especially those in the child welfare system, may not be ready to discuss their verbally. Art therapy offers a valuable alternative by allowing participants to express their emotions and experiences through creative means, facilitating healing and self-expression. The implications of a program based on expressive art therapy are significant, particularly for individuals who have experienced trauma. This program provides a platform for healing in a non-traditional clinical setting, while it offers a valuable alternative for individuals to express their pain and work through healing using art therapy tools. This is a need there's a need for further research. Future studies should explore the benefits of this intervention and identify ways to enhance the program. Thank you very much. Appreciate you taking the time to go through my program and learn about art therapy for youth in foster care.